Theft of drugs in Rwenzururu region has been rampant over the past years, and because of this, National Drug Authority (NDA) a few weeks ago has been carrying out operations across the country and especially in Kasese to uproot the illegal sellers of government drugs, especially antiretrovirals, commonly known as ARVs. According to Muhindo Jeanne Bukeka, who is the Director of Veterinary Services at NDA, she explains that the majority of the suspects during their operations are natives of Kasese.
That there is an upcoming habit of people stealing government drugs meant for the poor and the sick by some of the health workers. And I know you have also got this challenge. Through our operations, wherever we go cabinet ministers, it's unfortunate that through our enforcement, majority of the people who have arrested are our clansmen. We don't know how it comes about, but majority of the people we are getting in this place, majority of them are our Bakonjo clansmen. Recently there was an operation actually following our country, and I think 2 of our people were arrested, and they were stealing drugs from St. Mary's. You know, St. Mary's is private but has a supporting partnership with government. They were stealing some government drugs from there. They were arrested. We have people arrested in Mumbere, Doroko, still our Bakonjo persons. As I speak also Chenjojo, I'm supposed not have been here. There is a guest in Chenjojo again. One of our high-ranking AIP policemen was fought in this fight, and others in Kampala. So as a community, something that we need to tackle.
She adds that many drug shops around Kasese town have been closed since they don't meet the illegal requirements set by the National Drug Authority.
That they are fake herbalists that people deceiving because of these communicable diseases. So they have used that chance to deceive people. You have cancer, somebody comes up with a fake herbal and says we provide solution. People have hypertension, somebody comes and says I'm a herbalist, but comes up with a fake concoction. So we wanted protection for these subjects.
Dr. Chibaya Yusuf, District Veterinary Officer, Kasese, indicates that residents of Kasese still feed on sanga meat, which is believed to be contaminated with toxics, which would lead to health complications such as cancer.
What we have in the kingdom is that element of sanga. It believes me that everybody, if you go to the market, we are fighting it politically. Chairman Fight has clearly said we don't want sanga.
He, however, noted that political leaders have failed his office in fighting against the consumption of sanga meat, which is sold in various markets such as Mawa Market.
But when we go to the lower leaders in the LC3 and other people are saying we should consume sanga. And we have seen the trend of people suffering from different diseases. And I don't know whether it's a culture that we should eat bundu, the cassava cake with the meat doesn't go well with beans. I would advise people, like this, if you are not sure of the meat you are going to eat, try to take it with beans. So long you will survive the next year. And my request is, through the Prime Minister, you help us. These people are going to now fighting that advice.
Rwenzururu region and Kasese in particular is facing challenges of drug abuse among the youth. This is due to excessive consumption of alcohol, mairungi and marijuana. This costed the youth mentally when they become insane and others become mad people.
He also said there is need, Alan, to increase sensitization on drug and substance abuse. He said many people are committing suicide in this community, especially the youth. So that takes us to mental health as a trending subject. We need to know why are the youth and people committing suicide. Actually, he highlighted that many people use the rat poison. And he almost suggested that if NDA could withdraw the rat poison from shelves, or maybe it is highly controlled, but I don't think that's an issue. We need to find out what are these community health challenges that people are meeting that are leading to committing suicide. Currently, people have a lot of problems on the top of mental health.
Honorable Kule Gad, Minister for Youth in Obusinga Bwa Rwenzururu, implored the National Drug Authority to regulate the sale of various drugs, which has led to drug abuse among the youth.
When you don't use a drug for the purpose it is meant for, then you're already abusing it. We even have pharmacies who have drug shops which sell drugs which end up being narcotic to the brains of our people. And now, as NDA, we call upon you to come and carry out sensitization seminars, sensitization meetings. We make radio talk shows so that our youth know when and how to use these drugs. List of that, we may continue talking about marijuana, talking about opium, talking about these other substances, not knowing that there are some also drugs which are being sold in pharmacies, drugs sold in drug shops that are also antiseptic to the brains of our youth.
In a bid of bringing their services closer to the people in Kasese, National Drug Authority is looking forward to signing a memorandum of understanding with the Obusinga Bwa Rwenzururu so that cases of drug abuse, both in human and animals, are minimized and the theft of drugs from government hospitals is totally eradicated. The memorandum of understanding will also cater for improving on herbal medicine and regulating herbal doctors in the entire kingdom.
80% of our population in the world, their primary source of health care is herbal medicines. And in Uganda here, the Ministry of Health, through the public-private partnership for health, documented that 60% of our population is start with herbal medicine. So if you count 10 people, 6 of them have started from. This shows that we need to put a lot of emphasis on the quality and safety of our herbal medicine and to grow this sector, because it's indigenous to us, we're not able to lose it. And most of the population, we get different feedbacks. Some people say they work, some people say they don't. But what kind of evidence is there? What kind of products are they accessing? How are we preserving our knowledge? We come back to the issue of why we need to regulate and root out the fake products. Because regulation of the products in the sector is not to kill the sector, but to make it grow and ensure that people who make good products are protected and the population has access to safe products.
In a meeting that sat at Shilo Hotel in Kasese town between National Drug Authority officials and Obusinga Bwa Rwenzururu cabinet ministers led by the Deputy Prime Minister of Obusinga Bwa Rwenzururu, Hon Balitazare Kule Benson, he thanked NDA for the relationship established between the two entities that will produce fruits that will benefit everyone in the kingdom.
We are entering this partnership soon. I know the next step now is for us and NDA to debrief the king on what we have agreed upon, what we have discussed here. After that debriefing, at a later stage, there will be signing of the MOU. After the king has looked at what we have discussed, they are going to be summarized. After summarizing them, a draft MOU is going to come out of this discussion. After that draft MOU, then we shall go and debrief the king about it. And once the Omusinga has accepted, then time will be set when the MOU will be signed. Now, as we enter into this MOU, there are certain parameters that we must appreciate. Certain parameters of competencies. We must ensure that our people are really sensitized to be able to have the required competencies. You don't just go and say this shop should be, they are selling illegal drugs. Okay? The person who is there is not professional when actually you have not gone through the documents. You have not asked certain things. So those competencies are very important. A corrupt-free mind will make a good decision. A corrupt-free mind will make a good decision. If you go there with the mind of saying, you know, if you do this, I can leave you, then we are doomed. Okay? We are talking about a situation where we are assuring that we are minding about the health of our people. Don't give our people expired drugs, as Obusinga Bwa Rwenzururu we are saying. Don't give our people expired drugs. Okay? Don't use quack doctors. We are talking about things that affect the health of the people. Okay? Don't sell drugs that are meant for government and supplied for free. Okay? So these are issues that are very sensitive and very attractive, that those areas, if mishandled, can lead to chaos.
Mr. Kabuya Fred, who works in the Public Relations Office at National Drug Authority, highlighted on the key issues why NDA would like to work with Obusinga Bwa Rwenzururu in fulfilling its constitutional mandate, such as regulating the use of drugs and its production.
What is required of you, dear honorable ministers, is to organize yourself. Through Mr. Mukiaba there, you also organize your our sector. NDA will help you to facilitate you through that. Dr. Jeanne is here. You have problems. You have so many animals here. You have problems with them. Identify those problems. Approach your NDA. Will support you through Dr. Jeanne. You have so many illegalities. Mr. Kisa is there. You have a good talk with our residents, because for you, you know, who didn't go to nursing school? Who didn't go to the pharmacy school? Who doesn't qualify? But the moment you had that information from us, it's you to harvest it. That you are hiding under the table, one day you are going to enjoy that. So it's better now to bring it out. We see how we can help these people so that we will save the population, we save our families.